Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist. In today's video, I wanted to chat about something that I see get in the way of people's ability to heal. So for those of you who don't know, I help people with unresolved back, butt, and sciatic problems all over the world learn to fix themselves using movement as well as the mind as medicine so that people don't have to rely on others. Now, that being said, again, the purpose of today's video is to talk about something that really becomes a limiting factor in people's ability to heal at various points along the healing journey. So that thing that I want to discuss today is someone's belief system. So I want to talk about the power of beliefs and how those beliefs either have the ability to help or hinder you on your path to recovery. All right, and I've got some notes over here, so I'm going to read through them and just have a candid chat with everyone. Okay, so first things first, just recognize that, let's define beliefs as sort of those things which you believe to be true, right? And or false, right? Right or wrong, this or that, yeah, but, right? All these things that sort of pop into our brains and, guide our actions. So the reason that beliefs are so powerful when it comes to either helping you or hindering you, and I see it hinder people more than it does help them, but the reason that these beliefs are so powerful is because they directly inform our actions. So, for example, maybe you grew up and you were told that you should sit a certain way, or that sleeping a certain way was bad, or that you should have good posture, or that you should do this or that. Again, some right or wrong argument. Maybe you've recently started to experience pain and you have gone to see a chiropractor or a PT or somebody that you trust, right? And they told you that you should do this or you shouldn't do this. Or maybe there's an authority figure such as a neurosurgeon, orthopedic doctor, right? And you have credible in black and white evidence, right, to show that you have some type of arthritis or bulging disc or something like that, right? And once you've sort of formed these scripts or beliefs and you have conviction in them, such that you believe them to be true, right, then you generally live in accordance to those beliefs. So, for example, again, beliefs pop up at many different parts along the healing journey, but it generally starts from the top. So for example, let's just say you have some type of back, butt, or sciatica problem. Well, what happens is you start to hurt. And instead of immediately thinking like, oh, how can I fix this, right? Generally, people start to think of like, okay, well, what's the problem? So not solutions, they start to focus on the problem. And they say, okay, what's going on? That's the question that pops in people's brains. So naturally, right, a belief is that, hey, you need a diagnosis to initiate treatment, or you should figure out what this is first before you start trying to fool around with stuff. So what you do is, if you're like most people, right, you would go to the doctor or chiropractor or PT or something like that, but usually you'd get an X-ray, MRI, or start somewhere there to get a diagnostic picture, literally, of what is the problem or what is not. And so it starts at the diagnosis or kind of case level of like, what is going wrong with me, right? And so what we see, right, is that beliefs have the ability to box you in, especially if they start at the diagnostic level. So for example, if you were told that you have a spinal stenosis, or you have arthritis, or you have an SI joint problem, or insert any diagnosis, disc problem, disc herniation, right, into that example, well then you will follow suit and act in accordance with that belief. So, if you are told that you have an SI joint problem, a sacroiliac joint problem, you will go, right, and look for people who have experience treating SI joint problems, who have success treating these problems, and, you might search best exercises for SI joint problems on YouTube. And, anything outside of that, you won't listen to, right? Because the belief is not there. So, for example, why would you watch, if you've been told you have an SI joint problem, why would you watch and do maybe exercises for a disc problem or for spinal stenosis, right? And so what happens is that you very much box yourself in, because if you have, right, you have all these possibilities to help you without any beliefs, right? Because you're not glued to one specific thing, you have all these possible doors that you could open and try. And so your opportunities are wide, right? But when you're told you have one thing, then you very quickly shut those things out and you say, okay, boom. And maybe it works, maybe it doesn't. But again, it boxes you in. And the question becomes is like, hey, what if that's not right? And we see this every day, right? So again, a lot of people think like, hey, went here, doctor said I have this, so that must be. And while it may be that, just recognize that there's very little correlation between what is found on an image and the cause of pain, right? And so a lot of people have beliefs about what is causing their pain, diagnosis-wise, and it leads them down a rabbit hole. It leads them into like, oh, this is what I should do to fix my problem because this is what someone told me. So notice that this is all based off what someone told you. The evidence suggests, right, that there may or may not be any correlation between what you've actually been told and why you hurt, but because someone told you that and you believe it with conviction, you go down a path and it either has the potential to help or hinder you. In fact, right, when you didn't have any, when you weren't glued to any specific diagnosis, you had all these options to help you, but then when you were told you had this one thing, it actually narrowed your opportunity for success, right? It actually limited what you do to try to solve that. Because instead of being able to go and door A, B, C, and D, right, people say, nope, you've got a disc problem, you've got an SI joint problem, this is what you should do. And if it works, great. Doesn't necessarily mean that was the cause, right? Maybe you see it as confirmation of that, but for whatever reason, it worked. Awesome. But many times it doesn't work. It either doesn't make you any better and or it makes you worse. And so then what do? Well, then people force it, right? They keep trying the same things over and over again, and that's the definition of insanity, right? So for example, I just worked with a gentleman who believes so strongly that his problem was disc-related, and he loved Robin Mckenzie, okay? So he loved the Mckenzie method, and he said, hey, you know what, Charlie? I believe this will work. And so what he did is, when I say this, right, Mckenzie method is very well known for, although it's not completely true, but a lot of times people see it as, hey, I do these press-ups or I do these back bends, right? And while that is not really what Mckenzie is all about, a lot of people see it as that, okay? So perception becomes reality in this case, right? So, hey, I believe I have a disc problem. Therefore, instead of having all these options, Charlie, that doesn't make sense to me. I shouldn't do that. I shouldn't bend forward. Slouching is bad. All these beliefs become formed, right? And this person goes here to try to solve the problem. So, they start doing these press-ups because that's what they believe should work because that's what they have. Again, this is all based off theory and belief at this point, right? But you see how powerful this is, all right? And so this person does this for a few days and no change, no better. And, I say, hey, it's not working, right? So I know that's what you believe, but at what point are you willing to completely derail from or detach from those beliefs and seek another solution? This belief was so strong for this person, they kept going. And they continued, right, to do these press-ups for another, 4 weeks, 5 weeks, 6 weeks, and still 0% change in their symptoms, right? So at some point, these beliefs, even when logic and when data proves them to be false, people still hold on to them. And that's the power of belief, right? So this person believes so strongly in Mckenzie that they just kept doing Mckenzie for weeks and weeks and weeks with no improvement because of what they believed, right? And this happens, again, insert any diagnosis. If you have spinal stenosis, then you should do these things, but you shouldn't do these things. Bending your back backwards is bad, right? Bending your back forward is what you need. Well, it's not working, right? And so at what point, if things aren't working, are you willing to let go or detach from your beliefs? You have to ask yourself that, all right? So things are generally centered around faulty beliefs and or very strong, powerful beliefs are generally rooted in top to bottom. You start to hurt, you start to develop pain, so what do? You search for the cause, and then you have this black and white image, right, that is very much credible evidence to your brain and to you that this is the thing that's wrong. You believe this authority figure who told you that, and therefore you go down that path. And if it works, great, but a lot of times it doesn't. So you've got to be willing to break from this belief because realize that it could help or hinder you. In this case, it could hinder you. It can actually limit your possibility of getting better. Right? The other thing is that let's just say that someone's like, okay, Charlie, I don't care about the diagnosis. But maybe they have another belief as to the cause. So maybe it's not a medical diagnosis. Maybe it's another type of cause and or proposed cause for the symptoms. My core is weak, and people hold on to that. And so they go and they do McGill Big 3, they do planks, they do all this strengthening, all this stuff, right? And that guides them down another path. And so people hold on to beliefs about like, my pelvis is out of alignment, right? Again, yeah, diagnostically, this is what I was told was wrong with me. Or I feel like my hips are weak and I need to do that. And what's interesting is that people sort of need to race their own race. As much as I can tell people, hey, you realize there's no correlation between this or that, because there are exceptions, right? So for example, there are many strong people who are just completely jacked and have strong cores and do all kinds of sit-ups for days, right? But they have back pain. So when you have an exception like that, then you start to say, that can't be true. that statement of core weakness causes back pain can't be true, at least not in all cases. So you have to start to challenge these things, right? So at the end of the day, though, again, people very much hold on to these things, and unfortunately it takes people getting beat down, meaning going through the core strengthening approach, going down the rabbit hole of trying to fix their disc problem or SI joint problem before they would actually believe somebody like myself. Again, all the power of belief. The other thing as it relates to a specific case, right, and this just happened this morning, is that people often come to me and say, Dr. Charlie, like, my case is so complicated. Have you seen anything like this? And what's very interesting is that the sheer belief that the case, or that your case, if you're watching this, is complicated, the sheer belief of complicatedness of the case will actually keep you from getting better. Because if the case is complicated, then there must be some complicated solution that's needed, right? Actually, this is false. In my experience, the more gears, the more unknowns, the more complicatedness we have within the system, the simpler the solution and or the approach needs to be. Because if you try to treat a complicated problem with complicated interventions, then you have lots of moving parts and different variables over here, and then you take lots of moving parts and variables over here, and you put them together and you just get sheer chaos. So if you believe that your case is somehow different, unique, complicated, then that belief already makes you believe or think that the solution must be complicated and that, you're going to have more and more difficulty in solving it. And it limits your ability to get better, because you don't believe that you can live a life being pain-free and or having more control of your symptoms because your case is somehow unique, different, and or complicated, then the chance you're actually going to be able to get to a point where you feel good and are open to an intervention that is simple versus complicated is not very high. So you limit, again, your healing. All right, so hopefully that makes sense. So the first belief, right, is rooted in diagnosis. Charlie, I have scoliosis, and that's the cause of my pain. Well, you've had scoliosis your whole life, and now you're 55, and now scoliosis becomes the cause of your pain. It doesn't make logical sense, but people very much get rooted in these beliefs, even though the evidence is very suggestive otherwise. That there's no correlation or very little correlation between imaging findings and symptoms, and that the purpose of images in this case, which are to blame for a lot of things, and that's why it's not that I don't find value in them, just realize that the purpose of imaging is to rule out serious sinister pathology, fractures, tumors, infections, not rule in things like arthritis, because everybody has them, or has it, right, and it may or may not be the cause for why you hurt. All right, and then based off of that sort of diagnostic, belief about the case, belief about the cause, right, and the actions that follow, there's this whole idea or belief, another belief system that comes up, that this is what you should do or you shouldn't do. We talked about this a little bit, right? But, I just chatted with a woman the other day who's like, hey, I was told that I have this disc problem. That's what it seems like, Charlie. And so I've been sitting up really tall, like trying to make sure that I don't increase the pressure on the disc, push the jelly out the back of the donut. And I said, well, like, how does that feel, though? So that's your belief, but is that belief serving you? What's not working? Okay, so are you willing to detach from that belief and find what's comfortable for you? And that's a big take-home. So you have to make sure the beliefs are serving you. And if they're not, then you have to be willing to let them go. All right, so I said, well, how does that feel when you sit up tall? She said, like, well, it feels really achy, but, like, this is what I should do. And so I said, well, like, are you willing to consider that perhaps everything you've been told about what's going on with you is wrong? Are you willing to let that go? I may or may not be right, but it's not about being right or wrong. It's just a subtle shift in mindset. Are you willing to question and ask yourself, what if everything I've been led to believe is somehow incorrect? And so I said, just chill, just slouch. And, within a week of just chilling and slouching and doing everything she shouldn't do for her disc problem, right? 80, 90% better. Another woman, right? Like, hey, I was told, Charlie, that I shouldn't sleep like this. The chiropractor told me that I should not sleep on my belly because it's bad for my back. And so what she did is she flipped on over and started sleeping on her back. She said, sleeping on my back is terrible. I can't sleep at all. I said, then why are you doing it? She says, because I was told it's bad for my back. So she believed from this authority figure who told her, right, that sleeping on her back or sleeping on her belly was bad for her spine. Here's what's really interesting. She didn't have any pain when she was sleeping on her belly. But then when she started sleeping on her back based off what this person told her and the script or the story that person planned in their head, the narrative that was told by that professional, she started to develop back pain and leg pain when she started to sleep on her back. So I said, look, If you look at this logically, right, you had no pain when you were sleeping on your belly, but now you have all this pain and all this problem sleeping. Sleeping is very important. Do you want to sleep or do you not want to sleep? I want to sleep. Sleep on your back. Or sleep on your belly, sorry. So in this case, right, she was so strongly convinced that this belief was true that she completely altered her lifestyle. She bought new chairs, right, because she should sit like this or she shouldn't sit like this. She bought new mattress. She bought new shoes, right? Maybe you've done these things. You've got a closet full of different things, right, because of what people told you will work or what won't. But the truth is, at the end of the day, these are just beliefs and they're just theoretical. You have to be willing to do the detective work to find out what's going to work for you. All right. And so, again, the purpose of this video is just to talk to you about the power of belief, right? The power of belief of what is wrong with you. If you're able to detach from that and say, hey, rather than worrying about what is wrong with me, what can I do to fix it? And instead of labeling yourself with this thing and minimizing your chances of healing by going down just the avenue which is for that thing, are you willing to flip the script? Are you willing to flip the script on what you've told is right or what you've told is wrong? How you should sit, how you should sleep, how you should walk. That same lady who went from sleeping on her belly, which she loved for 50, 60 years, went to rolling her back and then developed pain. Started also walking, right? She said, hey, like, I walk with my one foot out a little bit. And she said, like, have you ever seen that? Is that good or bad? I said, well, how long have you been walking like that? She said, well, I don't know if I walked like that before, but like, you know, I try to fix it because I was told that's not a good thing to do. I said, well, who told you it wasn't a good thing to do? Well, someone I'm seeing for treatment of this problem. I said, well, does it feel good when you do that? She said, yeah, I love walking my foot slightly out. I don't know if that's how I walked before or not, but it feels yummy. It feels good. It feels safe. I said, so what happens when you try to correct that thing? She said, it hurts. I said, so are you willing to let that belief of like, that's not good, get in your way of walking with more comfort? Would you rather ascribe to that belief or would you rather feel good? And she said, I'd rather feel good. Cool, walk all day with your foot slightly turned out. So a lot of solving these problems is about breaking beliefs, right? Opening your eyes to the fact that, hey, is it possible that everything you've been told and or led to believe, right, is maybe not true? And I'm not saying don't listen to anybody. I'm just saying that, like, have a filter and have a checkpoint and question those things. It's good to question these things. And it's good to try to flip the script and say, what if I have this and I was told I should do this, but what if the opposite is true? What if instead of going this way, I should be moving my body that way? And be open to testing these things and be open to knowing that not everybody has the perfect solution, but you will be fed the perfect solution and many beliefs that people hold on to, and they will pass them down to you, okay? So unfortunately, as a consumer, you have to be willing to filter through these things, and you have to be willing to flip the script and let go of beliefs that are no longer serving you. At what point, when you're told you have this problem, you've tried lots and lots of things going down the path and it hasn't worked, are you willing to say, hey, maybe that's not accurate? All right, so that's all I've got. Again, this is Dr. Charlie, PT. Appreciate you checking this out, and do what you can to try to flip that script, to sort of practice some inverse thinking and question, right, things that you've been told by authority figures. It's okay to question authority, if you will, to break the rules. And a lot of times the only way you can solve these problems, which many people deal with for many, many years, is to break the rules and to go against traditional, conventional beliefs. So realize that if you can't break these beliefs, you will continue to ascribe to them and act in accordance with them. But if you can question them and break them, right, then you free up the opportunity to look outside and think outside the box and find different solutions. All right, so hopefully you like this. Give this a thumbs up and or comment below. I rambled a little bit, but hopefully you get the idea. So take some nuggets out of here, apply it, start belief breaking, and start to ask yourself again, how can I flip the script and question, what if everything I've been told up to this point is somehow inaccurate, wrong, not true, at least to some degree. All right, hopefully this is helpful, and let me know your thoughts below. Thanks.